Hey guys, a bit of a different video for you today. For those of you that know me, I'm Excoundrel and I used to be a doctor. For those of you that don't know me, I'm Excoundrel and I used to be a doctor. This video is about coronavirus. That's right, coronavirus. We're going to be talking about the virus and I'm going to be giving you guys as much information as possible. Because I know that sometimes it can be hard to find information from your governments or from your news outlets. So this video is primarily aimed at giving you guys as much information as possible, as well as helping protect you and your families, as well as the people around you. We're going to talk a bit about what is coronavirus, what it can do, the symptoms, that kind of thing, who it affects and who is most at risk, what you can do to prevent the spread and what you should be doing if you have any symptoms. And then we'll just kind of have a brief chat about government protocols and things like that. So what is coronavirus? Well, it is a novel form of viral strain that originated in China. It is from the same family as this 2009 SARS outbreak. And whilst we don't know how it originated, because that's not important, what we do know is it spread very quickly within China and has now spread to a global scale. Coronavirus produces a variety of symptoms, but the most consistent are a dry, persistent cough, fever and chills, and flu-like symptoms. So if you've got flu-like symptoms and you are worried about having contracted coronavirus, you should be looking to self-isolate. But I will talk about that a little bit later on. Other symptoms that I have found associated online or through anecdotal evidence is cold-like symptoms. For instance, you can get a very initial set of cold-like symptoms, which can then come back and be more flu-like. Generally, we're hearing that it tends to be in two peaks. You get a mild exposure, which is like a sort of a mild cold, sniffy nose, runny nose, and then a few days later, it drops off and then it comes back a bit more heavily with flu-like symptoms. So if you've got a cold, don't write it off as you don't have coronavirus. Make sure that you take every precaution. But some people are also presenting with things like headaches, aches. So these are all coming under flu-like symptoms, but also diarrhea. We're also getting nausea and a bit of vomiting as well. Anything that is usually associated with the flu, coronavirus can cause. One of the most sort of drastic effects that coronavirus can have is something called interstitial pneumonia. This is generally only confined to those people who have serious health conditions, are immunosuppressed, have existing lung issues, or are older with a lot of comorbidities as well. Interstitial pneumonia is a pneumonia that affects the lungs or the lining outside of the lungs and actually can cause the patient to find it very difficult to breathe. What we are finding with a lot of these cases is that they actually need ventilation to survive. You're seeing in Italy right now because Italy has one of the oldest populations on earth because of the Mediterranean diets. They are finding that a lot of their older patients are really in need of ventilation to keep themselves alive, and unfortunately they are now having to triage that ventilation because they do not have enough of the machines to go around. So it's a very serious disease at its most drastic effects, and that of course means that if you have older relatives, you may feel that they are at risk. Now, coronavirus affects mostly, we'll see the effects on older 65 to 69 and over people. They're the brunt of the effects. We'll also see effects in our age, so anywhere from 10 to sort of 50, you will get flu-like symptoms. Some people have reported very mild cases, some people have reported more heavy cases, but you generally tend to get more flu-like symptoms. However, they are not serious enough to warrant going to hospital, and you often do not end up with the interstitial pneumonia. That is generally confined to patients that have serious health conditions, are immunosuppressed, are older, or have comorbidities. We are finding that children, even in the very young, do not display many symptoms at all, and if they do, they are usually very mild. Now, we don't know why that is. It is something to do with the immune response to coronavirus. We are finding that the children, maybe with underdeveloped immune systems or immune systems that aren't quite so rigid as the adults' immune systems, are actually not responding in a way that is damaging their body. And so children are actually displaying very few symptoms, and we have yet to see a case of child mortality in the world, I think. Now, that's from reading some sources. If you know of any child mortality cases, then obviously feel free to comment down below. But I think that even if we have seen child mortality, it is made up of single-digit numbers, if that. And most of the mortality has been in older patients or patients with comorbidities or immunosuppressed. So if you are fit, healthy, under the age of 60, you're probably going to be okay. But it's not about you. It's about the people that you know that are at risk. And that's why we're going to talk a little bit about what to do if you are worried that you have contracted coronavirus, you have been in contact with someone who has coronavirus or has been in a high-risk country, or if you have symptoms. So that's what we're going to talk about now. So what do you do if you fear you have got symptoms of coronavirus, have been in contact with someone with coronavirus, or you've either been to a high-risk country yourself, or you have come in contact with someone who's been in a high-risk country? Well, first of all, I'll tell you my story. My parents work in northern Italy. They recently came back. I was in contact with my mum, and I felt that I was now at high risk of having contracted the virus, even though there is no evidence to say that I have no symptoms. I am currently in self-isolation. So if you have any of the symptoms, specifically a dry persistent cough, flu-like symptoms, which is headache, fever, aches, pain, sweating, you have trouble or difficulty breathing, or you have anything like a sudden random onset of diarrhea, if that's not something that you're usually used to, or anything like that, then it is probably worth you considering self-isolation. Self-isolation is where you keep yourself at home for at least 7 days. So the UK protocol right now is 7 days. Now, some countries are saying 14 days. The UK believes that the evidence is that the coronavirus is most... at least when you show symptoms, the coronavirus is the most virulent when you are between 1 and 7 days of showing symptoms. So take that as you will. Basically, 7 days isolation is better than none, and 14 days is better than both, but not everybody can manage 14 days isolation due to food stores or whatever. When you are in self-isolation, though, you should be limiting your contact with anyone that doesn't live in your house. If you are having deliveries, they are left outside the door. If you are seeing family members, they are either coming and keeping a 2-meter distance from you, not touching anything in the house, wearing gloves, wearing masks, whatever, or you are wearing a mask if you're going to see your family or anything like that. But you really should be trying to keep yourself isolated at home for as long as possible. Now, that is not possible with everybody who needs to work. Now, if you are home from work and you do not have the chance to go to work because of self-isolation, some governments are providing relief for those of you that are off work. Some companies will pay, for instance, your company may pay you to self-isolate. If you're self-employed, the government may give you a small stipend. I know the government is giving like £93 per week, which is pittance, obviously, but it is better than nothing to those of you self-employed that self-isolate in the UK. But just make sure you check with your employer or try and find some government information. You can Google it. Usually you'll be able to find some kind of result about what you can do in terms of monetary support if you have to self-isolate and you're away from work. So when you are self-isolating, that's what you want to try and aim to do. If you want to prepare to self-isolate, or you think that you're going to have to prepare yourself to self-isolate, make sure you buy a small amount of stocks. What you're finding in a lot of shops is that all the pasta, all the rice, all the long-term food basics are being taken right now. I actually went shopping just before I decided to self-isolate, before I had the contact with my mum, just because I knew that I'd have to see my mum and I was going to have to self-isolate. But basically, you should be... I bought things like lentils. I bought things like canned goods. I bought things like long storage ready meals and stuff like that, as well as things I could put in my freezer. So there are definitely things that you can buy that aren't pasta and rice. I love lentils, and I bought an absolute metric crap ton of them. So I've got plenty of food for the next week, and probably for the next 2 months if I really wanted to. I've got so many canned goods in the house. So yeah, that's what you should be doing. You should be looking to self-isolate if you've got any symptoms. If you break that self-isolation and you see any of your older family or friends, you could be putting them at risk. Now remember, just because you are young and you're not showing many symptoms does not mean you are just not as deadly as anybody else. The reason that a lot of governments are shutting schools is because kids do not get symptoms or get very mild symptoms, but they spread it between them like wildfire. And then those kids go home and they see their parents and their grandparents, and suddenly they're infecting people who are at risk. I'm not worried for Rupert, for instance, because he's in an age group that doesn't really show many symptoms. Rupert has been completely fine despite having seen his grandparents. And I currently have no symptoms, and I'm currently very well. If I get any symptoms, I'll definitely let you guys know. But yeah, I'm currently very well right now. So you should be looking to self-isolate. as much as you can if you have those symptoms, or you've been in contact with anybody that's come back from somewhere like China, come back from somewhere like Japan, come back from somewhere like South Korea, any other countries like northern Italy that have been considered high risk. But that is only going to be lasting for the next few weeks. I'm certain that a lot of other countries in the world will suddenly become high risk, and it won't matter where you've come from. But just remember, if you've done, in fact, to be honest, if you've done any airport travel recently, like I had done a lot of airport travel in the build-up when the coronavirus was just emerging, and I was definitely putting myself at risk by doing that. So if you've done any airport travel, make sure you consider yourself a potential high risk, and just keep an eye on yourself and your symptoms. You don't have to be taking your temperature all the time, but if you do have a thermometer, that will help. But I always just make sure I'm putting my hand on my head, back of the hand on the head. Much easier to assess temperature with the back of your hand. Just to sort of feel how I'm feeling, but I'm feeling okay right now, so hopefully that will continue. So that is what you should be doing if you are considering yourself at risk, and I just implore you to take it seriously. This is not just the regular flu. Yes, the winter flu kills a lot of people, but we also vaccinate the elderly, we vaccinate people at risk, we understand how it spreads, and generally the mortality rate is much lower than what we can see from coronavirus. Coronavirus is deadly because we don't really have a clue how to treat it. It's viral, it's viral, and it seems to be spreading at, maybe more so the rate of the winter flu. And we don't have a vaccination for it, and we can't vaccinate at-risk people. But also, the reason that it is more deadly than the flu is that the flu generally affects people over an elongated period of time, like 4 months. What we're finding right now is people are getting very ill very quickly, and it's overloading our health systems. The countries that are prepared, like Taiwan, Singapore, Japan, South Korea, they're seeing a very low mortality rate of below 1%. The countries that are not prepared, like Italy, their mortality rate is up at 3 or 4% because they're just unable to treat the most ill people in their country. They are just unable to treat them because they do not have the resources to do so. So just be very aware, be very, very aware that this is not just like the regular flu, and I don't want you guys to think it's like the regular flu, because that's a dangerous mindset to have. The last thing, though, is to not panic. This is definitely something that is impactful. It will definitely kill, unfortunately, a lot of people in our communities. But try not to panic. The worst thing that you can do is go and buy all the bloody toilet paper that no one else can use it, and you suddenly have found yourselves with like 50,000 rolls of toilet paper, and well, good luck. I'm sure your Halloween is going to be fantastic. Just make sure you're kind and considerate to other people in your community. Everybody needs a chance to stock up and feel safe in this scenario. The governments are doing what they can. Now, specifically about the governments, there is a wide variety of tactics that governments are employing. You look at somewhere like Taiwan, they handled the outbreak immediately. In January, they were issuing masks to everybody. They were banning travel to and from China. They were trying to prevent the outbreak in that way. And actually, they've limited their cases to a very, very small amount. This is the same in somewhere like Singapore, where they've been really strict, and Japan have also got a really good grip. South Korea, whilst they had a lot of cases, were very well prepared, and they have gradually increased their sort of strict rules to make sure they are delaying the spread as much as possible, and they are seeming like they've got enough healthcare facilities to deal with the very ill patients. And so South Korea is also seemingly handling the situation very well. Somewhere like Italy, where they were late to enact any kind of preventative measures, and they suddenly found that everybody was getting infected and they couldn't cope, and their healthcare system was getting overwhelmed, and now they've thrown everything, they've thrown the kitchen sink at it. That's the kind of country that's going to struggle. The UK has recently just announced that they are going to their initial protocol is that if you are ill, you self-isolate for 1 week. If you have any symptoms that could be in any way associated with coronavirus, you self-isolate for at least 1 week. That is their only protocol right now. Now, if you've read my tweets, you'll know that I think that this was a little bit too light. Now, I'm not saying that I don't agree with the science behind what the UK have done here, because the UK are planning to use the most powerful containment tactics when they feel that the disease is hitting its peak in terms of a number of people affected in the UK. They want to flatten the peak rather than stop it altogether. At this point in the UK, we have so many people infected, or so many people potentially infected, that we cannot stop the spread of coronavirus anymore. It's just not going to happen. The issue that I criticise with the UK government's plan is they believe there are between 5,000 and 10,000 people infected across the UK. I think that is wildly under I think it's about 20,000 to 40,000. And so they consider themselves 4 weeks behind Italy. I think we're more like 10 days to 2 weeks behind Italy. That's just my personal opinion, and from talking to my friends and doctors that are currently still working in the health service. So there are lots of different ways of approaching this situation. Somewhere like Portugal or Denmark, they are going all out. They're closing schools. They're trying to stop the spread. The science behind this is two distinct methods. You either stop the spread. So that's what you're seeing with Portugal and with places like Denmark. They have got a limited number of cases and they want to cut that as soon as they can. The problem with those types of protocols is how long can you keep those kind of quarantine measures in place? How long can you keep those in place? You can't stop kids going to school forever because the peak of coronavirus is expected within 14 to 16 weeks globally. And across some nations. So you can't keep people at home for 14 to 16 weeks. It's just never going to happen. People need to work, otherwise they're not going to have the money. People are going to need to go to the shops because they won't have the food. And if you keep kids at home for 14 to 16 weeks, who's going to deal with the childcare? And more importantly, what's going to happen to all those kids that then need to go on to take exams or progress in the education system? So whilst those quarantine measures are a good way of trying to stop the outbreak, and Taiwan basically immediately did it and kept their cases very low. The problem is that you might just be delaying the infection rather than stopping it altogether. I think at this point it's going to be very difficult to stop spread in countries, even if you have some of the most the harsh measures in place. Because I mean, when are you going to start reopening travel to affected countries like countries that are into full quarantine, for instance? When are you going to start accepting flights? Because the moment that you accept flights into your country and you've already started, or you've kept the cases low, it's just going to spread again, because there are going to be people that are sort of very late carriers, and they're going to be super spreaders, and then suddenly no one in your country's got immunity, and then we're going to get another small pandemic in countries that have shut everything off immediately. The UK's plan, whilst I agree with it in action, I think they could have been a bit stricter straight away, just because I feel like we're a bit further ahead than they estimate. But the UK's plan is, we understand that everybody's going to get this, or at least a lot of people are going to get this. 80% of the country is predicted to pick up coronavirus. But what we are doing is we are just ramping up the delay procedures. So we're starting off with self-isolation, and then once more people get it, we're going to bring out things like travel bans. We're going to bring out things like maybe closing schools when it gets really bad. But they essentially want to save their heavy hitting policies for when the peak is highest, so they reduce that peak. And then, so when the most, because basically when the most people are infected, when you're looking at 40 to 50% people in the country infected, that's when most other people are going to get infected, because there are more people that currently have the virus, and therefore more people are going to get the virus. So you want to reduce that peak so that less people, or the people that do, when you start enacting the really heavy quarantine measures, is when the most people possible have the virus, so that they prevent the spread as much as possible. So that, yes, of course, there's going to be little bits of spread, but it will not be as bad as if you just let everybody do what they wanted at the very peak of the coronavirus outbreak. So that's why the UK has enacted these measures specifically. However, the tactic here is that they know that people are going to get very ill. They know that people are going to die. They just want to make sure that the NHS is dealing with the initial outbreak, and then they have enough space to then go on, and they can prepare and also go on to have enough space to deal with people who get very ill beyond that. So they're basically trying to, I guess, limit the amount of people coming into the NHS at a time, and trying to just clear out patients and bring new patients in, clear out patients, bring new patients in. But essentially the point is that eventually by the end of this, herd immunity will be so strong in the UK that we shouldn't be able to spread the coronavirus easily. So we should have like a strong enough herd immunity that if someone infected comes into the UK, then most people will be immune, and it will not spread as rapidly as it did before. The problem with countries that are enacting very strict protocols right now at very low numbers is that when you lift those protocols, who's going to have the immunity when someone comes into the country, or someone still has coronavirus and it starts spreading again? That's the worry, and I think the UK has that worry. Like, if we go strict now, how long can we sustain it, and how long before someone comes back into the country, or we just get another outbreak? Because basically what you end up with is a double peak. You get the peak, strict protocols down, and then you get another peak because you couldn't eradicate it entirely, and it just picks up again once you lift those protocols. Because at the end of the day, like I said, in the UK, if we closed our schools now, it's March, like the peak of coronavirus is expected within 14 to 16 weeks. Like you're looking at June time, July time. That's when exams are, and if you keep kids at home from school for 4 months, who's gonna look after them? How are we going to work? What are you going to do with all the kids that are supposed to go up a year in September? Like, are we just missing half of the year? We're just going to say redo the year? Like, are we going to halt the entire education system for a year? Like, it's a very, very, very difficult thing to navigate. So the Public Health England have said that basically we want to delay the spread, so that we know people are going to get it, but we want to be able to deal with it at each stage, which I think is probably pretty sensible. But again, we'll find out how wrong we are in next week if things just start to blow up. I expect that the UK is going to ramp up their quarantine protocols very quickly. It's a very difficult thing to navigate. No one really knows how to deal with coronavirus the best, but like I said, you just need to look after yourselves and be smart, make sure you're washing your hands, and make sure you're just being strict about self-isolation if you need to take it. So just a little PSA today, guys. Look after yourselves, and I'm sure we'll all get through this okay.